Akash Bist of Panchadebal Binayak Municipality 4, Kalikasthan of Acham is a health worker by profession. In 2015, while studying in Kathmandu, patches were seen in his body, which was non-itching and senseless, hypopigmented and anesthetic. Studying the auxiliary health worker AHW, he easily guessed that the patches on his skin were a symptom of leprosy. He went to civil hospital for treatment. From there he was referred to Anand Hospital. After being diagnosed by Anand Hospital, he was completely cured after taking leprosy medicine MDT for 2 years.
Hello, Namaste. My name is Akash Bist, and I reside in Panchadewal Vinayak Municipality, specifically in Kalikasthan 4. Currently, I work as an auxiliary health worker AHW at the Kuchi Health Post. Back in 2014-2015, I underwent treatment for leprosy. During that time, I was studying in Kathmandu. Initially, I noticed non-itchy and numb patches on my skin. Concerned, I sought medical attention at the civil hospital in Kathmandu. They referred me to Anand Hospital, where several tests, including a biopsy, were conducted. The diagnosis confirmed leprosy. The doctors recommended multi-drug therapy, MDT, for 1 year. I diligently followed the medication regimen, although I experienced a reaction at one point. Consequently, the treatment was extended for an additional year. After a total of 2 years of consistent medication, I became completely disease-free.
He states that discrimination against people affected by leprosy still exists in our community. Despite being educated and working as a health worker, he has personally experienced discrimination, which compelled him to conceal his illness.
I don't know anyone in my house taking leprosy medicine. I don't even know where this disease came from. But since it is a less contagious disease, I came in contact with a leprosy patient who had not started the medicine, so I may gotten infected from them. After being affected by leprosy, I faced discrimination from my close friends. Until now, I could not come openly because of the fear of being discriminated against.
In the early days, he could not reveal that he was an affected person. He came openly during the collection of GPS of affected people during the leprosy prevention campaign being conducted by NLR Nepal and Nepal National Social Welfare Association NNSWA in Acham district.
My name is Prem Bohra. I also work at the Kuchi Health Post. My colleague, Akash Bist, and I have been working here for a few years. However, he never disclosed that he was affected by leprosy. But during the collection of GPS data for affected individuals, he openly revealed his condition.
There is still a misconception in our society that leprosy is caused by sin. If transmission were truly due to sin, all people would be persons affected by leprosy. This disease is not caused by sin but by bacteria.
Being a person affected by leprosy, he understands well the pain of discrimination suffered by the affected people. He says that due to discrimination, patients are not open and are forced to hide their illness. He thinks that persons affected by leprosy should be treated respectfully without discrimination. Furthermore, he carefully examines the suspicious patients who come to his health institution and give necessary advice.
I am a health worker as well as a person affected by leprosy. I have been working with the goal of eliminating leprosy and ending discrimination against it. Not only that, but I carefully monitor the dermatology patients who come to my clinic. Furthermore, I provide necessary counseling and information to end leprosy and discrimination against it.
He says, I have understood leprosy. I have experienced the discrimination that an affected person has to endure. I will work for the prevention of leprosy and the end of discrimination against leprosy.